Yesterday, South Africa announced that it was putting a temporary hold on the rollout of the Oxford AstraZeneca vaccine after a study showed it was minimally effective at preventing mild to moderate disease caused by a variant first identified in South Africa. This is clearly concerning news. However, there are some important caveats. Given the limited sample size of the trial and the younger, healthier profile of the participants, it's important to determine whether or not the vaccine remains effective in preventing more severe illness.
WHO participants present in the room are...
But that study, which looked at only mild and moderate infections, raised concerns. Not because that we were not expecting some diminishing activity, but it was the level to which it was diminished. And so now we are unclear and uncertain about the efficacy of the vaccine in preventing hospitalization and severe disease. We know from the overall trial that the AstraZeneca vaccine is effective against other pre-existing variants. We're just not confident about its efficacy against the 501YV2 variant.
Swaminathan, Chief Scientist, Dr.
In the next few days, WHO expects to make a decision on the emergency use listing of the Oxford AstraZeneca vaccine for the 2 sites in India and the Republic of Korea, which will produce it for COVAX. We're committed to using all available data to make these assessments. In the meantime, COVAX continues to prepare for its first quarter distribution and to add to its vaccine portfolio.
On the WHO website, the press briefing is now...
We certainly have anticipated that the virus could mutate. In fact, scientists have working in laboratories anticipated some of the mutations, and this is one of the values actually of doing the science. It allows us to essentially to look into the future, to look at possibilities that may occur, and to help us look out for mutations that would be of concern
right now in order to wait to...
Everybody's looking at the data right now, and there are a range of ways that this can be approached. But I think what was most clear that came out from the SAGE meeting is that in looking at the evidence on the AstraZeneca vaccine across a number of trials, it is very clear that it has efficacy against severe disease, hospitalizations, and deaths. Among the variants and different variants, there is some reduction in, some indications of reduction in the efficacy, some more, some less, depending on which variant, which population, and also of the neutralizing antibody responses. But we also have evidence that there is the likelihood that the retention of meaningful impact against severe disease is a very plausible scenario for the product against the B1351 variant.
Everyone, I am Fadila Shaib speaking to you from...
Yesterday, a new case of Ebola was reported near the city of Butembo in the Democratic Republic of the Congo. Butembo is the North Kivu province. It is in the North Kivu province, where a previous outbreak was declared over in June last year. The woman who sadly has died was married to an Ebola survivor. Thanks to the enormous capacity built during the latest outbreak, provincial health authorities have significant experience in responding to Ebola and in preventing onward transmission. More than 70 contacts have been identified, and WHO is supporting local and national authorities to trace them and provide care where needed.
I believe Mr. Richard